those two separate categories? Do you think differently about someone who had a heart attack before versus someone who just has risk factors when you're thinking about prevention?
Yes, well, when we talk about prevention, you're absolutely right. There are sort of two forms. There's primary prevention and there's secondary prevention. Primary prevention means you haven't had a heart attack or you haven't had other manifestations of narrowing in the blood vessels in the heart. For example, the so-called angina, the chest discomfort that comes from exertion because the blood vessel isn't totally closed, but it's severely narrowed, and you're asking the heart to work harder, but it's not getting enough blood flow. That means you already have the disease. You have the disease, we then want to prevent you from going on to develop a heart attack, so now we move into secondary prevention. It turns out the treatments are the same, that what prevents the atherosclerosis also helps to decrease its progression, it's getting worse, and the cracking or tearing of that atherosclerotic part of the artery leading to a blood clot. And there are things like...
I just want to make sure I understood you correctly.
Yes.
So it sounds like whether we're talking about primary prevention for someone who's never had a heart attack,
correct,
or secondary prevention for someone who has had a heart attack, the strategies are the same, but the sense of urgency and importance might be different for someone.
Absolutely. And so, for example, if I were seeing, these are typical patients. I see a patient who comes in and says, my father had a heart attack at age 55, and my brother has high cholesterol. And we would check the cholesterol and we would check their blood pressure and talk to them about regular exercise, eating right, not smoking, and so forth. That would be a typical primary prevention person. There's no evidence that they already have the disease. On the other hand, the person who's already had a heart attack, we know they had the disease. So we're going to be perhaps even more aggressive in that person because we don't want to prevent the process from starting, or we want to hinder it from getting started. The other person, we know it's there, and we're hoping even with some of these therapies, we can pull a little bit of that cholesterol stuff out of the artery wall and markedly decrease the chance that they're going to have another heart attack.